did the Prime Minister need to make any statements in relation to ministers? No. Okay. Thank you. The Prime Minister has a call.
In terms of, thank you, Mr. Speaker. Since the beginning of this year, as at the 15th of February, 711 people have died in residential aged care facilities. Deaths reported in residential aged care facilities in total to the 9th of February of this year is 5,728. Mr. Speaker, every single life that has been lost to this virus, whether here or around the world, is a terrible tragedy for the families affected by those deaths. And that is one of the objectives that our government, working with other governments around the country, have worked tirelessly to seek to minimise through the course of this pandemic. And we will continue to do that, Mr. Speaker. We will continue to do that. The work that we've done and the additional supports that we've put in place, which indeed have been supported by the Minister for Aged Care Services, led by the Minister for Aged Care, who is in this House, Mr. Speaker, have been there to ensure that Australia, when compared with other countries around the world, have had one of the lowest rates of fatalities from COVID, including in residential aged care facilities. And so I say this, Mr. Speaker, that while we mourn the loss of those who have passed away in aged care, who have had COVID when they've passed away, and as the Chief Medical Officer has been at pains to point out, passing away with COVID, Mr. Speaker, is not the same of passing away because of COVID. Now, those opposite may interject on that, Mr. Speaker, but that is the medical advice which has been provided by the Chief Medical Officer. But I would say this, Mr. Speaker,
members on my
that
left,
for every life that has been lost, which we grieve, we give great thanks for the many thousands of lives, Mr. Speaker, that have been saved by the actions of our aged care workers, our aged care providers, the actions of health care workers across the system, the nurses, the government officials and indeed the policy leadership that has been provided by the government, Mr. Speaker, including the Minister for Health and Aged Care and the Minister for Aged Care Services. So, Mr. Speaker, if those opposite wish to use these issues for political exploitation, that is a matter for them. We will continue to get on with the job of saving as many lives as we have over the course of this pandemic.